everybody, I am Sitali Vajay English language teacher. Today, with the education, you can become happy. Means the education will provide you good life, means happy, healthy, and the life with all good circumstances, isn't it? Of course. If you are investing for the education, then you are investing for a good way. Quality education is the first best investment to your life. That is why you should try to study hard and invest all your hard work to the education. As our ideology of Asian Medical Institute is the purity, first, in order to get this quality education, you should be pure and also demand the purity from your environment. Only then we will succeed in this life. So let's start today's our topic. Today's our topic is the terminology for direction, location, position, and the body movements. In our medical terminology, we are using anatomical names for body, location, direction, and the planes of body. So what are they? As you see in this picture, this body is divided into several parts. Transverse, coronal plane, like this here. So now we are discussing in detail what are they. Here first you see anatomical positions for the anatomical positions and the direction of body. First you see anterior. Anterior is the front side of body. For example, thoracic cavity is located anterior at the anterior side of body. Anterior means front side. Posterior is a medical term used to describe the back side of the body. Then midline means in the center or medial. This medial or midline also used to describe the part of body where it's located in the center. Lateral means from two sides. For example, arms are lateral to the body, means two arms are lateral, means from two sides of the body. Superior, the root word means upper, so superior means upper, or upper means upper side to the body. For example, the head is superior to the maybe thoracic cavity. For example, means here head is located at the superior, at the upper side to thoracic cavity. You are describing. Maybe thoracic cavity is superior to abdominal cavity, like this you can describe. But you will not say it's located upper or it's located down. Yeah? Inferior means down. Here we have also the synonym for inferior, it's caudal. You can say abdominal cavity is located inferior to thoracic cavity, or abdominal cavity is located caudal to inferior cavity. Next, superficial. The difference between superior and the superficial, you should know, guys, superior is upper, superficial is on the surface. What can be on the surface? Superficial, for example, something on that part of the body. Superficial here can be, for example, hair, nose, lips are superficial to the head or to the face. Deep means inside, within the body. For example, internal organs are deep within the body, liver is deep within the body, heart is deep within the body. Means it's inside the body. Proximal and the distal. Proximal, it's near. Proxim means near to the body. For example, near to one structure, I mean. Same, thoracic cavity is proximal to abdominal cavity, because after thoracic cavity, below abdominal cavity. Or just like you can here use the term, knees are proximal to tarsal, means they are near. Distal away, Shoulders are distal to knees. From shoulders to knees there are too many structures. That is why distal will be far from the center or from one point of attachment. Next, body planes and the cavities. So these planes of body that we have discussed now with you, so they are cranial cavity, spinal here given, together they will be dorsal cavity. Then we have ventral cavity. It's ventral, as you know, also known as anterior side here, thoracic, abdominal and the pelvic. Whether abdominal and pelvic cavities are known as abdominopelvic cavities. So together ventral cavity and dorsal. In general it's divided into two. Dorsal, it's that head part, and the ventral cavity that includes thoracic, abdominal and the pelvic cavities. So dorsal cavity, here we include the head and the spinal cord. Thoracic cavity, here we include the lungs. Abdominal cavity, internal organs, the GI tract for example, and the pelvic cavity, reproductive organs. Reproductive organs are housing in pelvic cavity. So these are the cavities of body. Anatomical positions. If you are the doctor or just medical students, you should use the medical terms in order to describe the position of your patients in these anatomical positions. So, what is Fowler's position? Fowler's position is the position in which the part of head and the part of knees are elevated. So, you realize that usually this position you see at the hospitals. Your patient's position can be in Fowler's position. Whether sometimes or usually it can be in semi-Fowler. Semi prefix means half. So it means half Fowler's position. So what it can be? Here the part of head only elevated, knees are not elevated. So it's the semi-Fowler's position. Lithotomy position. Lithotomy position also we just name as gynecological position. In this the patient is sitting on his back. The patient is sitting on her back and then legs are separated. For example, for observation of vagina, for example. Prone position. Prone position, in this position the patient is lying on his stomach, not on his back. The patient is lying on his stomach. So it's the prone position. Orthopnea position. Ortho means straight. So it's the straight ventricle position of the patient. Recumbent position. Recumbent position also same as supine position or also known as horizontal position, guys. Or here only knees can be little bit bent. So it's known as recumbent position. Seams position, the patient is lying on his stomach with the left side of his body. It's known as a seams position. Next is supine position. Supine position, you know, supines are boneless. So here the patient is lying on his back, straight. It's also known as horizontal position or supine position. Terminology for the body movements. What body movements we have? First, flexion. Flexion is a bending. Flexing, that means extension. Vice versa, if you were bending, flexion. In the extension, you will straighten your arm, for example. Abduction. Abd prefix means away. So abduction is movement away from the center. Adduction, vice versa, will be toward the center, means again coming back to the center. Protrusion. Protrusion means forward to one structure. Retrusion, backward from one structure. Elevation, it's superiorly, little bit upper to the axis. Inversion, in means inside, e means out. So inversion, turning movement inside the body. Eversion, turning movement away from the body. For the preparation of this book, we have used the medical terminology in context by Melody Hull. You can use also this terminology. The individual work for this topic, you will be prefixes for the colors. Again, you will study the prefixes for the colors and revise these anatomical terms for body location, direction, position and movement. Thank you for your attention. Good luck.